Welcome back to Isaac's Dentistry. We're glad to have you joining us today. Today we thought we'd do something a little different and give you a tour of our facility and what we have to offer here at Isaac's Dentistry. Other than general dentistry, we've covered the fact that we've got a great orthodontist who comes in. We also have 2 hygienists that work here in the office. So we thought we'd invite you in from when you would walk in the office, kind of give you a tour of the facility and kind of get you relaxed and a little more knowledgeable about what to expect when you do come see us here at Isaac Dentistry. So as you come in, you'll walk into our wonderful lobby here. We've got a great big screen TV for you to relax and watch Channel 6 on. We've got couches and chairs, different ways for you to relax while you're waiting to be seen by us. And as you come in, we have everybody come up to our main counter where Barbara is waiting to greet you. This way we can get any of your paperwork done, update insurance cards, things of that nature, set a future appointment for you if you need to. But also it's a good way to make sure you check in so we in the back know that you're here and we can pull you back and get to started and working on you as quick as possible and try to make it as quick and as seamless as we can for everyone. So from here, we head back to the back. And we've got multiple rooms. I'm going to show you one side of our office, and the other side is just a mirror image with the exact same setup. But our different rooms have different purposes, and we use them for different reasons. So room 1 is where we're heading now. And what's great about this room is we call it our root canal room. It's not, I say great, but for people who hear root canal, it's, they get a little freaked out. But we talked about that a couple episodes ago, and it's really not a big deal. The reason we use this room is our chair is a little more versatile. We can lay people back a little further than normal, but we've got a huge counter space. And with root canals, we have a little bit more equipment we put out. So it gives the doctor plenty of room to work. And with our computers, we're attached over here. Every room's equipped. I just opened that right in everybody's way. We've got X-ray right here in the room. And that's for all of our rooms. Every single room here at Isaac's Dentistry, you don't have to leave the room for our basic x-rays. So there's a lot of x-ray taking during a root canal. So while you're here without inconveniencing you, getting you up, moving you around the office too much, we can go ahead and take our x-rays right here and instantaneously pull them up on our computer. Again, it's a whole nother part of our digital dentistry that we do here along with our digital scans for crowns and bridges and partials. We try to make it as quick as possible for the doc so he can diagnose and get moving on right away. So room 1, it's a basic room, except for the chair is set up a little better for us to handle the root canal process, and the equipment is all set up here so we can do those root canals and those a little more advanced procedures and take care of you in one sitting without moving you around too much or jostling you around the office too much. We're going to head over next door to what we would call room 2. Now this room, even though I said root canals, we do everything in here. We can do extractions, we can do fillings, we can do all the basic things in here. We always do general exams, but we focus on it as a specialty room. If we need it, we'll keep it open for those specialty procedures if we know that we have those coming up on the schedule. So if you follow me over next door, over here in room 2, this room is a little unique. And the reason I say that, again, we've got our x-ray right here that we saw on the other side. We could pull those up immediately, but we've put special chairs into this room. These chairs are designed for our larger guests, our larger patients, but they're also designed with our nursing facility patients in mind as well. They're made to help support them with their seating if they have trouble sitting, but it also gives us more room to actually transfer the patient into these seats and be able to get them over comfortably from a wheelchair or another walker or any device they might need for assistance. Other than the chair, our light in here is special. A lot of things we do here in the office, they light cure. We use a light to harden the material. We use a light to set that material up. Well, this normal white light that you see right now will actually harden those materials. It'll actually start to set those materials up. These rooms here, this room and this light, and again, there's a mirror image on the other side, comes with a special yellow filter. And just by changing that light to a nice yellow, it then creates, it's a non-cure light. So it removes the light source that would actually harden those materials or set those things up faster so we have more time to work on you without causing a complication of premature hardening or what we call setting off the material. So again, we try to specialize as much as we can and make the experience as good as we can for everyone. All of our rooms are equipped with water. We also have a little bowl here if you need to rinse out, and we can rinse those bowls out so you can rinse, and you know, you'll hear us say it about 5 times a day, rinse and spit. So we're fully set up over here behind the camera. All of our rooms also have water. That's not just for our purposes, but we have a lot of patients who come in with dentures or things of that nature that need to clean them up. And rather than having to leave the room to go into a bathroom or something like that, we do have that access here as well. But it also allows us, for certain things we're doing in the office, to mix up different materials or to wash hands, clean things, and make sure everything's staying sterile as we're doing our procedures. Each room has what we call a delivery tray. This has the doc's basic equipment on it. It's got his basic instruments and then a selection of either drill or polisher, a little air and water nozzle so we can keep the mouth dry or clean or wash it out after we've done certain procedures. And that's room 2. So it's kind of specialized for our nursing facility, our handicap, our larger folks. The chairs are specially designed. They're wider, they're a little more comfortable for folks that need that extra comfort or that extra support in their different procedures. And again, we can do anything in here. If we needed to, we can actually move root canal stuff in here and do it if we had to, but we can do fillings, we can do impressions for dentures, we can do cleanings, we can do just about anything in this room as we can in the other room. It's the actual chair and the patient experience that we've geared to try to make easier for you and more comfortable while you're here visiting with us and having your work done here at Isaac's Dentistry. And so we're going to go next door, and that'll be our third specific type of room. And again, I want to reiterate, what you're seeing here, 1, 2, and 3, they are mirrored on the other side, identical in the same position and on the other side. So we've got double of everything that I'm showing you, which really allows us to bring multiple patients back and perform multiple procedures at the same time. So here at Isaac's Dentistry, we do have 2 hygienists that work here. They do an amazing job. And where I'm taking you now is into one of our hygienists' room. And again, it's a specialized room. And the reason is they have a specialized skill with the cleaning. You'll notice in their room as well, they've got their own designated x-ray that they can pull up digitally to see what's going on, but it's also tied into the entire office. So in any room, we can actually pull those x-rays up and monitor what's going on. So the doctor, if there's a filling that needs to be done after a cleaning, we can have access to those photos and we can see them ahead of time, and we can pull them up in another room so we're prepared and ready to go. The hygienist's chairs, again, they're a little different. They lay back a little differently, mostly with a foot pedal, because a lot of the hygienists are always busy with their hands, and we're able to adjust the headrest to what we need for each specific patient. Some people need more neck support, some people need less head support, so they've got a very versatile headrest. Their equipment is pretty similar. They've got suctions and drills and water and air, but they also have an ultrasonic water, which is for during the cleanings, for cleaning your teeth and getting below that gum line. It's an ultrasonic water jet that can really get in there, knock that plaque off, and help get those teeth cleaned way down below the gum line without causing too much discomfort of having a metal pick or something going down there. And each hygienist has that same setup, and they're able to do those types of procedures on you. So this is kind of our third specialty room that is specific to our hygienists. Now, if you're here and you're getting a cleaning and they noticed you have a filling, or we've got a sensitive tooth, or maybe a toothache that's been going on, we would then move you from one of these rooms into one of the other 2 rooms so the doctor can come in, do a full evaluation, look at those x-rays that we've taken in here, and we could diagnose exactly what the problem is and get you fixed and get you back onto a pain-free life. So, very important room here. They stay really busy, so if you're going to come out here to Isaac's Dentistry, get yourself a good cleaning, which we recommend at least 2 a year or every 6 months. Give us a call. We schedule a couple weeks out a lot of times on that. We do have a waiting list for cancellations as well. So give us a call and get yourself in here to see one of our wonderful hygienists. Now, every once in a while, there's a specialty x-ray that needs to be taken, and it's called a Panorex. So instead of taking specific teeth, we're actually wanting to look at your entire mouth. All of the teeth, the bone structure, and all of that that's going on. So what we will do is we'll bring you to the back of the office over here, and I'll show you. Over here is our Panorex machine. So this big machine here, it doesn't touch you. This big piece here goes all the way around your head, but it gives us the technology to actually take a full mouth x-ray of all your teeth, the bone structure. We can even see your sinuses on this, and it gives the doc a good overview of what's going on, the spacing, and how everything is situated in your mouth. A lot of times this is the first method of diagnosing a problem that's going on. So we'll take our Panorex, and again, it's tied to every computer in the office. So as we bring you back into your room, we're able to pull that x-ray up instantaneously, and the doctor is able to read it immediately with no lag time, no developing time, and we can get an instant report on exactly what we're seeing on that x-ray. So as you come back through the hallway a little bit, we've got our restroom, we've got our lab back here where we'll do some work. But we wanted to bring you back into the office and just kind of show you what to expect when you come. From the moment you walk through the door, where are you going, what are we doing, and why do we have these different rooms? We have people who come in and say, oh, I was in another room another time. Well, sometimes that's just based on what room's full and what room's not, but a lot of times it's based on what are we needing to do and what are we going to be working on today. So we want to thank y'all for coming and visiting us here at Isaac's Dentistry again, and we can't wait to see you next month.